So, good afternoon, everyone. We are excited to present you DIABIN, a comprehensive system that just doesn't, that doesn't just detect diabetic foot complications early, but also keep patients engaged, adherent, and motivated. Think of it as your personal ally against diabetic foot complications, from detection to defense. So, India has over 212 million people living with diabetes, and in every one, at every four, are at a high risk for developing diabetic foot ulcers. A complication that often goes unnoticed until it's very too late. This is worsened by two realities: our calorie dense diet, rooted in our agrarian history, and our modern sedentary lifestyle. In rural areas, ulcers are missed due to lack of detection. In urban areas, people are too busy to notice the symptoms. And across both groups, medication and lifestyle, both adherence is poor. There is a clear unmet need, not just for early detection, but for personalized language adaptive motivation that actually works. So, coming to the stakeholders. So, who's affected by this? Almost everyone: patients, caregivers, doctors, ASHA workers, policymakers, and ultimately the government. Each of them needs one thing: a system that can detect early, educate simply, and most importantly, motivate effectively. Because awareness without action changes nothing. So, coming to our solution and our answer is salivate and diabin. Salivate is a gum that detects early markers of diabetic foot ulcer through saliva. And diabin is our personalized app that reads color change using AI, interprets it, and gives the user guidance and motivation. The voice of someone they actually care and love about. Because emotion can drive action far better than cold alerts ever could. So, salivate. Salivate is an innovative and non-invasive diagnostic gum. The science is simple but powerful. Certain biomarkers like procalcitonin, IL-18 rise in saliva when foot ulcers begin to form. Our gum contains gold nanoparticles bound to antibodies that change color in presence of these markers. That color is then scanned and interpreted by the app. No pricks, no pain, and just a chew. This is the mechanism. How is the patient is going to chew the gum? The color is going to change, and the disease is going to get detection. So, coming to the mechanism of action, here's the science behind it. We conjugate gold nanoparticles with antibodies against these markers. And biomarkers like procalcitonin, pentraxin, IL-18 are proven to rise in diabetic foot ulcer cases. Color intensity always correlates with the disease progression. It's simple to use and scalable. And most importantly, it opens a gateway for early intervention that has been missing for many years. And coming to Diavin, the app that actually cares. So let us understand what happens after detection. That's where Diavin app steps in. It reads the color of the gum, uses AI to detect the change and the disease stage. Disease stage provides voice-guided, emotionally resonant motivation to keep the patient on track. Patient can hear the progress updates, encouragement, and reminders, and all in their own language and in the even in the voice of the louder. Because motivation is medicine. The key features of diabetes. So let's talk about features. Early detection to through image recognition. This is progression tracking, risk prediction using behavioral data, personal and education used via Bharat GPT, which speaks all 22 Indian languages, and voice-based motivation generated by using AI from someone patients emotionally trust, from someone patients who are emotionally bonded to and trust, and because motivation needs habit building. So we introduced, we made Diavin a gamified app. So it is inspired by Duolingo, which which has daily streaks, goal tracking, real-time feedback on health improvements, and cost-saving projections. Patients not only see how they're improving, but they also see the money they are saving by staying healthy. So coming to the big idea. So what are we really doing? We're building a low-cost, accessible, and diagnostic behavioral ecosystem. Salivate detects and Diavel motivates. Together, they empower. Coming to the impact. With early detection and sustained adherence, you can drastically reduce the number of amputations and improve the quality of life for millions of people, all while making healthcare emotionally intelligent and behaviorally effective. You can understand the impact of this, right? So let's go to the technical feasibility. So every part our system deals with. I mean, every part of our system which needs, every part needed by our system already exists. Salivary biomarkers, gold nanoparticle diagnostics, AI image recognition, voice cloning, Bharat GPT language integration. We are not reinventing the wheel. We are assembling the machine to actually move the people who need it. We know the challenges, especially in rural areas where smartphone access is low. That's why we use voice-based motivation, even over basic phones if needed. And salivate, when massively produced, can cost as low as 10 rupees, cheaper than the glucometer strip. This is not a luxury solution. It's a public health game changer. And all our scientific backing and inspiration is cited here from biomarker studies to behavioral research on adherence and voice motivation. Happy to deep dive into any of this if needed. So, Diamond is more than an app or device. It's a new way of thinking about chronic disease, one where we detect early, educate better, and motivate deeper, not just to treat diabetes, but to defeat it. Thank you.